Hello, my name is Ruth Abaya, and I am a physician in the Division of Emergency Medicine here at the Children's Hospital of Philadelphia. I would like to tell you about a research study that we are conducting here on treatment for young children 2 to 5 years of age who have a diagnosis of asthma and come to the emergency department for a mild asthma flare. You should have already been given a copy of the written consent form. You should thoroughly read the consent form in addition to watching this video. After viewing the video and reviewing the consent form, a staff member will be available to answer any questions that you may have. You are being invited to participate because you have a history of asthma and are coming in today with an asthma flare. You have received dexamethasone, a steroid medication that is part of asthma treatment while you were here in the ER. In the past, all children received 2 doses of this medication, one in the emergency room and one at home 1 to 2 days later. However, younger children with mild asthma may require less steroids than older children or children with severe asthma. The amount of steroid treatment that will help your child improve is not fully understood. If you agree to participate in our study, you will be assigned by chance, which is like flipping a coin, to receive either a second dose of dexamethasone at home or a placebo, a safe sugar solution that does not have any medicine in it. Neither you nor your doctor will know which treatment you receive. The specifics of how the medication will be given are described in the consent form. If you participate, you will be given the medication at the time that you are discharged. You will receive all other standard therapy given to patients with asthma in this emergency department. If you participate, we will also ask questions about your health. Once you go home from the hospital, we will call you in approximately 3 to 4 days and then again in 9 to 10 days to find out how you have been since leaving CHOP. This call should take less than 10 minutes. Dexamethasone has been used for asthma for years and is known to be safe. It is rare for patients to have side effects, especially if they tolerated the dose they received in the emergency department. The placebo is also a solution that has been reviewed by the hospital pharmacy. However, these medications do have known side effects. Please review your consent materials for further details on both dexamethasone and placebo. The main side effect you may experience would be persistence of your asthma symptoms, such as coughing and wheezing, if you require a second dose of steroid medication. If symptoms persist, you may require a second dose of steroid medicine at a later date. The purpose of this study is to determine how necessary that second dose is in children with mild asthma. We do not know if you will have a direct benefit from this study, but the results will help us to know if a second dose of steroids is necessary for children. Steroids given in normal doses for short periods of time are usually well tolerated, but even small doses can have some side effects, such as upset stomach or behavioral changes. Reducing the amount of steroid medicines given to children so they get only as much as they need is a potential benefit of the study. If you do not want to take part in this study, you will receive standard therapy that CHOP uses for asthma, which includes a prescription for dexamethasone. Your current and future care at CHOP will not be affected if you do not want to take part in this study. We will take careful measures to keep your health information private as allowed by law. Please review the confidentiality section of the consent form for more information. You can choose to withdraw from the study at any time. You will not be charged for study medications, and the rest of your care will be charged in the usual manner. For your time and effort in this study, we will provide you with a $10 gift certificate at the conclusion of the study. Please take time to review the consent form in more detail, and please feel free to ask any questions you may have about the study. Thank you for taking the time to consider being part of this research study.